New blood pressure guidelines came out this week, putting half of all Americans in the high blood pressure category. Now, under these guidelines, 130 over 80 is now considered high. It used to be 140 over 90. Well, doctors say by lowering the range, we can alert people to the risks and reduce the chances that somebody develops heart disease. Dr. Eugene Yang from UW Medicine is here to talk to us about these changes. And first of all, I want to get really basic with you. What is blood pressure?
So blood pressure consists of two numbers. The first number, or the top number, is the systolic blood pressure, and that number represents the pressure that's generated in your blood vessels when your heart is contracting. So when it's in a contracted state, that's what the top number reflects. The bottom number, the diastolic blood pressure, is the pressure in your blood vessels when your heart muscles relaxed. So those are the two numbers that we measure to determine whether somebody needs to be treated or not.
Okay, so now that these new guidelines are out, they've been lowered so more people have high blood pressure. Are there symptoms that people will notice if they have high blood pressure?
So I think that's one of the reasons why there has been more attention drawn to this. So these are the first new set of guidelines that have come out in 14 years. And one of the challenges is that most people walking around may not feel their blood pressure, and so it's sort of called the silent killer, because people can have very elevated readings but not be aware that their blood pressure is high. And the consequences of that are pretty significant.
So what are the consequences, the risks for your heart?
So as a cardiologist, we unfortunately see sort of the end of the road, meaning that the patients come in when they're having a heart attack or they develop congestive heart failure. So long-standing high blood pressure can lead to these potentially fatal events. And so that's part of the reason why there's been an interest in greater awareness. And so with these new targets, more people will be diagnosed with it, which means that more people will be aware of it and allow us to be more aggressive at treating it earlier.
And so does that mean more people will need to go on medication?
So yes, I think that's certainly been one of the concerns that people have raised, is that with lowering the standard, more people will be diagnosed with high blood pressure. And so when we look at the evidence, about half of the population will be diagnosed with high blood pressure. So based on the old guidelines, about a third, and now almost half of people will be diagnosed with it. Overall, about 9% more people will be recommended to take medications as a result of the new guidelines.
Okay, and David and I were talking about this earlier. You talk about heart disease down the road and you look at some of the serious consequences. Can high blood pressure, if left untreated, cause a heart attack, a stroke, both? What are the biggest concerns that you have?
Right, so absolutely. So if we look at preventable causes of heart attack and stroke, high blood pressure is the second most sort of common risk factor that is a preventable cause of heart attack and stroke. The first is tobacco use. So clearly the downstream consequences of high blood pressure are the things that are exposing people to the risk of death. So heart attack, stroke, heart failure, blindness, kidney disease, dialysis. So the downstream effects of untreated high blood pressure can lead to very serious illnesses.
And just quickly, if you're not on medication for it, there are lifestyle changes that can help reverse the situation?
Absolutely. So I think one of the key things is that I don't think we're advocating that we just go immediately to taking medications. In fact, it's quite the opposite, that everything, it really focuses on lifestyle changes. So weight reduction, exercise, making dietary changes, smoking cessation, weight optimization. So all of those things are really incorporated into the guidelines as being sort of the primary focus of our efforts. And then if blood pressures cannot be lowered through those measures, that's when we start thinking about treating patients with medication.
All right, well, thank you for giving us a better look at the numbers and what they mean, and go get checked and figure out what it means for you. Dr. Yang, appreciate your time. And if you would like to read more about the new guidelines or see some of our other healthy living segments, you can go to Q13Fox.com/healthyliving.